The views and opinions expressed on My Story Living with Lupus podcast represents each person's individual experience. By listening to this podcast or reading our blog, you agree not to use this podcast or blog as medical advice to treat any medical condition in either yourself or others. As always, consult your own physician for any medical issues that you may be having. My Story Living with Lupus podcast is officially trademarked, all rights reserved. Thank you for joining me for another episode of My Story Living with Lupus. I'm so glad that you could join me on this Friday, March 20th, 2020. Today's topic is all about hypertrophic lupus erythematosus. That's right, that's what we'll be talking about. So everyone from the U.S. all the way down to Puerto Rico, you know what I want you to do. Grab your cup of coffee, your cup of tea, and to all my listeners late at night, grab that favorite glass of wine and join the conversation right here on My Story Living with Lupus. The Charlie E. and Minnie P. Hendricks Foundation for Chronic Illness Awareness. See one, reach one, educate one to empower the masses, giving hope and empowering those who suffer from chronic illness. You can reach the foundation at 313-303-9217 or visit their website at https://cemphfoundation.com. This is a 501c3 organization. No one should live in lack. Verrucous lupus erythematosus, HLE, hypertrophic variant of chronic cutaneous lupus erythematosus. That is some of the other names of this condition. Hypertrophic lupus erythematosus, better known as HLE, is described as a rare subtype of chronic cutaneous lupus erythematosus, better known as CCLE, that form a group of autoimmune disorders affecting primarily the skin. You may ask, what is hypertrophic lupus erythematosus? Hypertrophic lupus erythematosus is described as a rare subtype of chronic cutaneous lupus erythematosus that form a group of autoimmune disorders affecting primarily the skin. Autoimmune disorders cause the body to mistake normal healthy tissues and organs for dangerous foreign material and attack them, leading to long-term chronic inflammation. Hypertrophic lupus erythematosus is also classified as an uncommon variant of discoid lupus erythematosus that presents disc-shaped skin lesions on the head and neck regions. In many cases, hypertrophic lupus erythematosus may be misdiagnosed as other skin conditions, such as hypertrophic lichen planus, due to a similarity between the conditions and relatively rarity of HLE. HLE usually affects middle-aged women and is characterized by thickened skin plaques with or without scaling, usually on the arms or face. In many cases, discoid skin lesions are also present. The exact cause of HLE is not yet known. In a few cases, it is associated with SLE, which is a serious disorder that can potentially involve several organs and systems of the body. The condition may be diagnosed through physical examination, complete medical history, and using specialized blood tests. The treatment of HLE may involve topical applications, oral medication, phototherapy, and systemic corticosteroids for severe symptoms. The prognosis depends on the severity of the disorder and its response to therapy. In case of delayed diagnosis and or treatment, HLE can result in complications such as scarring and severe emotional stress. When we return, we'll talk further into who gets HLE, age and sex distribution. So stay with me. If you would like to appear on an episode of My Story Living with Lupus, you can contact us at mystorylivingwithlupus@gmail.com. Also visit us on our Instagram page and also our website, My Story Living with Lupus. Ophthalmology Associates, PC, Drs. Berman and Dr. Zuckerbrod, treating diseases of the eye and eye surgery. You can reach them at 313-341-3450. Thank you for joining me back. We're talking about hypertrophic lupus erythematosus. Who gets it? Individuals of any age may be affected by HLE, but it is more commonly seen in young and middle-aged adults. Women are more prone to be affected than men. Both fair-skinned and dark-skinned individuals can be affected, although darker-skinned Africans and Asians have a higher risk than fair-skinned Caucasians for HLE. What are the risk factors for HLE? Predisposing factors. Risk factors associated with HLE may include presence of SLE, an autoimmune disorder affecting several systems and organs of the body. It is reported that about 25% of chronic cutaneous lupus erythematosus cases are associated with SLE. Female gender, genetic predisposition, a family history of cutaneous lupus erythematosus, which may be related to HLA genetic makeup, may increase one's risk. It is important to note that having a risk factor does not mean that one will get the condition. A risk factor increases one's chances of getting a condition compared to an individual without the risk factors. Some risk factors are more important than others. Now, also not having a risk factor does not mean that an individual will not get the condition. It is always important to discuss the effect of risk factors with your healthcare provider. You may be wondering, what are the causes of HLE? Now, the exact cause of HLE is not fully known or understood. It is most likely an autoimmune disorder where antibodies of the body that fight diseases or infections attack one's own healthy tissues instead. Such an attack by the body's immune cells against its own tissue can be severe, resulting in significant signs and symptoms. HLE is usually not associated with SLE. When associated with SLE, it can often result in inflammation in other parts of the body. Some individuals may have a genetic predisposition for the condition, which may then be triggered by infections, certain drugs, or on exposure to sunlight. Another question: what are the signs and symptoms of HLE? These signs and symptoms of HLE may vary from one individual to another. It may be mild in some individuals or severe in others, and may include the skin patches are in the form of highly thickened plaques with hardened borders, scaling minimal, but this may vary from one individual to another. The lesions are non-itchy, well-defined, and may show whitish patches. Most are present on the forearm, head, and neck region, including the face, and chest and back, typically on sun-exposed areas. The skin lesions can resemble viral warts. It may give rise to a suspicion of squamous cell skin cancer in some cases. If it affects the palms and soles, it is called palm plantar lupus erythematosus, which is a type of palm plantar keratoderma. These may appear as vocal, localized lesions, or diffused, widespread lesions. Some hypertrophic lesions are large, about 5 centimeters in size, irregular, and may involve the elbows. Additionally, in HLE, the presence of discoid skin lesions, characteristics, or discoid lupus erythematosus are usually noted. The skin lesions heal with scarring. Now, exposure to sunlight makes the condition worse. The signs and symptoms of SLE erythematosus, if present, may be noted. Apart from the skin involvement of various body organs, it has been reported that chronic SLE may also show HLE skin lesions. Now, certain factors can worsen the signs and symptoms, causing flare-ups, and these include trauma, smoking, certain viral infections, certain medications, and hormonal influence. Has your rheumatologist ever told you or mentioned HLE before to you? If you have shown any signs or symptoms of HLE. That's why I told you it is so very important, and I'm going to keep emphasizing this to you to research. Do your own research. It is more to lupus than the 5-letter word lupus, Lupus. You may hear or you may read about the common everyday factors that we all know. The flare-ups, cutaneous lupus, discoid lupus, but it's more to lupus that is being stated. That's why I say it's important that you become empowered with knowledge about this illness, because at any time, who is to say we won't or we will have signs of hypertrophic lupus erythematosus? This is a 2-part series, and the series will conclude on March the 27th. Stay with me. I'll be right back. I want you guys to understand something. I'm the type of individual, when I'm advocating for anything, I'm going to find out and research everything I can on that particular subject or cause. There is more to lupus, and I'm going to keep repeating it, to lupus. I want someone who is going to advocate to bring facts about everything. Don't leave anything out regarding this chronic illness. That's why I spend weeks upon months doing research. I pull out the research papers that I have written in college on this particular illness. I go through all of my medical journals. I do all of that because I am the type of person that loves to be, I not only love to be, I have to be informed when it comes to my health. And if someone asks me a question, I want to tell you exactly where to go. And if I don't know, I know exactly where to look to get you what you need. So, I say all of that to say this to you guys. No matter how bad things are right now, no matter how stuck you feel, no matter how many days you spent crying, no matter how many days you spent wishing things were different, no matter how hopeless and depressed you feel, I promise you, you won't feel this way forever, but you have to keep going. I'm Susan Hendricks, your host for my story, Living with Lupus. You are not alone. I'm on this journey with you. I'll see you next week for the conclusion of part 2 of hypertrophic lupus erythematosus. May you have a most positive, peaceful, and oh so blessed weekend. See you next week. opinions expressed on my story, Living with Lupus podcast, represents each person's individual experience. By listening to this podcast or reading our blog, you agree not to use this podcast or blog as medical advice to treat any medical condition in either yourself or others. As always, consult your own physician for any medical issues that you may be having. My story, Living with Lupus podcast, is officially trademarked, all rights reserved.